Hi class, this is my flashcard for week 10 for syphilis. So syphilis is a chronic bacterial infection that's caused by an anaerobic bacteria called Treponema pallidum. The bacteria is primarily sexually transmitted, but it can also be shared by contaminated blood products, IV drug abuse, and from mother to baby during childbirth. The bacteria has a corkscrew-like shape, as you can see in this little thumbprint photo here. And there are 4 stages to the infection. So the primary stage is commonly identified by an open sore called a chancre, and it is painless, firm, ulcerated nodule that forms at contact on the skin or mucosa about 3 weeks after the primary contact. Often it is perhaps seen on the external genitals. It can take place internally in the vagina. The sore can appear on the mouth and kind of look at the edge of a lip like a cold sore. Because it's painless and the sore heals spontaneously without treatment, an infected person may actually miss the lesion and possible diagnosis. The inflammatory healing process begins at the lesion, and sometimes lymphadenopathy may be the only symptom during that stage. The second stage of the infection happens when the bacteria enters the general circulation and causes a widespread rash that is maculopapular and reddish. It appears also on the palms of the hands and the soles of the feet. A latent stage may persist for years in a patient that goes untreated. Occasionally, the skin lesions do reappear, but the patient remains asymptomatic, transmitting the bacterial infection without knowledge. And with tertiary syphilis, the lesions progress to what's called a gamma stage, forming areas of necrosis and fibrosis that leads to regions of destruction where the gammas form. The cardiovascular system is often a prime target for this bacterial gamma, leading to damage of the arterial wall and development of the aortic system. Additionally, neurological syphilis, where the neurons are affected in the brain and can sometimes present with like dementia-like symptoms. Risk factors are unprotected sexual contact with an infected person, because the transmission occurs by contact from the exudate of the lesion or bodily fluids, including semen, blood, vaginal secretions that happen during sexual contact. And it's possible that syphilis can also be transmitted during the first years of the latent phase. So that initial sore that we talked about is stage 1, 3 to 90 days after exposure. This kind of body rash that can also be seen on the palms of the hands and soles of the feet is 4 to 10 weeks after initial infection. And then stage 3 is 3 to 15 years after initial infection and affects internal organs. Here's a closer picture of the rash on the soles of the feet. Symptoms of the second stage of syphilis can include a low-grade fever, malaise, headaches, conjunctivitis, GI upset, swollen lymph nodes, and of course the rash. For diagnostic testing, it's a rapid plasma regain, so a blood sample, checking for the syphilis bacteria, and it's identified by electron microscope. The Department of Public Health also begins partner notification for sexual partners in the previous 3 months. Because cases of syphilis are again on the rise, they should be included with regular STD and sexually transmitted infection screenings. One thing of note about syphilis is the Tychoski syphilis project that took place down in Alabama in the 1930s and 40s, where African-American men were purposefully infected with syphilis to study the process. Even though with the introduction and treatment of penicillin, the syphilis bacteria is easily eradicated, these men were allowed to kind of progress through stages of syphilis. And it's often something that comes up when we talk about ethical medics. And there are my references. Thanks.